Changing the conversation about terminal illness. Marie Curie has been caring for people living with a terminal illness and their families for over 60 years. Whether it's terminal cancer or any other illness, we want people to be able to get the most from the time they have left. We provide hands-on nursing care in people's homes and specialist care in our hospices. Working with others across the UK, we want to make sure everyone who is living with a terminal illness has access to high-quality care and support which meets all of their needs. But our ageing population means that more and more people will require specialist care while our health and our social care system is already stretched. We need to be ready for this unprecedented challenge. People living with a terminal illness are living with complex needs and will often have many different long-term conditions at once. Many of these needs are currently unmet or unrecognised. Carers tell us that as many as 7 out of 10 people with a terminal illness do not get all the care and support they need. If we don't act now, these problems are only going to get worse. Over the next 25 years, the number of deaths will increase by 100,000 a year. That's one more person dying every 5 minutes. This means a dramatic increase in the number of people living with a terminal illness in the UK. To cope with this new demand, the conversation about terminal illness must change. It needs to tackle the big issues and find the right solutions. Where will the resources come from? How will people be able to choose where and how they will live towards the end of their life? Who will support families and communities so that they can give people living with a terminal illness the care that they need? How will professionals get the training they need to provide care with knowledge, confidence and compassion? How do we make sure that people with a terminal illness get the same quality and ease of access to care regardless of who they are, where they live, or what their illness is? These issues affect us all, so we all need to take part in the conversation, from people with a terminal illness to those supporting a loved one, from health and social care professionals to service planners and policymakers, and you. If solutions aren't found, we as a society will fail vulnerable people at the time when they need us most. To find out how your support can help us deliver our vision of a better life for people and their families living with a terminal illness, visit mariecurie.org.uk/change.